The most effective mid-face lift, I like the 6 43 centimeter mint threads, and for the brows I like the fines, 4 of them. They work mainly on the tail of the brows. I inject in a tumescent fashion 60 cc's of 0.5% lidocaine with epinephrine with some bicarb to take away the sting. I use 25 gauge 2-inch needles, inject all the way along the tracks, and you see they're actually too messed up a bit. You notice the tracks are all parallel to each other. You get the most use of the barbs that way. I make 6 1.5 millimeter punch incisions in the hairline. I'm actually very high in the hairline. And then I'm putting 3 43 centimeter threads per side. So each thread gets its own 2 holes. So there's no threads sharing holes. And that way the threads can all stay parallel, and all the barbs are being used to lift the face. None of them are overlapping. The blunt temporal passer is inside of the sharp passer. You pass them with a deep sub-Q, and then you pull back on the blunt passer to allow the sharp one to pass through the skin. And whenever you pass these threads in, you're going to notice that the hairs get pulled in with the thread. So at the end, when you pull the threads, you do have to pull the hairs back out, or it won't allow those punch incisions to heal. So then you cut them after you pull them tight, and make sure that you push back on the skin where you're cutting them. And then you re-prep the other side if necessary. Make another 6 1.5 millimeter punch incisions, all parallel to each other, essentially every centimeter. You then put the temporal passer in to 3 different spots, and you're putting 3 different 43 centimeter threads, and then you're passing them all parallel in the deep subcutaneous space, making sure it doesn't dimple anything on the way in. You're pulling back on the dilator to allow the sharp cannula to pierce, and you thread these 43 centimeter barbs threads. You notice each one is parallel to the other. No threads are overlapping. You always add more numbing if needed. And you're essentially, each one is about 1 centimeter apart. You pull the threads tight, you pull all the hair back out that got pulled in with the threads. I use a forceps for that. And when you pull these threads tight, it lifts the face. I lift it as high as it'll go, because you can always release it more later. And you got to cut these threads that are excess short by pushing the skin back whenever you're cutting, and then you release any obvious thread. Puckers, just don't release them too much. I can always release them later. And then I like to clean any of the blood off and marks with some hydrogen peroxide. And then I'm going to be doing the brows. I always find I need to inject a little more numbing just beneath the brow where the mint fines are going to enter. And after it's numb on each side, then we make 18 gauge needle holes. And there's going to be one at the tail of the brow and one at the natural arch of the brow. You're aiming superior lateral, you pass 2 mint fines, deep sub-Q, you go all the way to the hub of the needle, and then even a little beyond, and you're going into the temporal hair. You cut off the excess thread after you're lifting them up and pulling them short, and then you release only the obvious dimples. Once again, you can always release more later. Then I add 5 PDO mono threads per side and the subdermal plane on top of the barbed threads. These are 38 millimeter by 27 gauge needles. And I even just leave the needles in until the end, that way you know where you were, and you release only the obvious dimples. This is immediately after. The swelling goes away over a couple hours. Here you're seeing her 4 days later. The cheeks and eyes are clearly lifted, and then 9 days later, she's looking much more youthful with the jowls and the marionette folds, and the cat eyebrow lift is obviously shown, but looks natural.